Hey ladies, so it's Kiosha. I'm back for another video. So today I'm recording a video, episode 3 of Life with Crohn's. This video is just going to be an update of everything that's been going on with me. If you follow me on Instagram, you know I was recently hospitalized and I had some medicine issues. So we're just going to talk about that update today. If you like this video, please make sure you guys subscribe, give it a thumbs up, and let's just get into the video. Okay, so where I left off in my last video was I was recently hospitalized. I was diagnosed with Crohn's and I was on Prednisone and I was going to start Humira. So since then I have started Humira and I've been on Prednisone. So let's just rewind to when I got out of the hospital. I got out of the hospital June 18th, 19th, somewhere around there. It'll be in my first video, sometime in the middle of June. I saw my new gastro doctor for the first time on July the 1st. On July 1st, he prescribed me Prednisone, to keep taking Prednisone for, for 3 weeks. So I was doing a step down program. When I first left out of the hospital, I was on 40 milligrams of Prednisone, down to 20, and then down to 10. Well, actually 4 weeks and down to 5, okay? So during that time, I wasn't on the Humira yet. We had to get the prior authorization and all that kind of thing, and we were getting it set up. So while I was on the Prednisone, I did get my first delivery. Humira came July the 13th. So, and then I didn't take my first shot until July the 15th. But during that time, as he was stepping me down off of the Prednisone, I was having inflammation again. So Prednisone was basically helping the inflammation stay down until I can get to the Humira so my Crohn's wouldn't flare up. So during that time stepping down, it didn't seem to work, so he had to step me back up until the Humira came. Now mind you, when you're on Humira, it takes 8 to 12 weeks to actually get into your system to work. So even though I was going to take the Humira in a couple of weeks or after he prescribed me the Prednisone, it wasn't going to work as fast as I wanted it to. So in that case, when he was stepping me down and we started Humira, so I've basically been taking, since that day, since July 15th, I've been taking Humira and Prednisone. I haven't been able to come off the Prednisone without having some kind of inflammation. It's just whenever I get off of it, a couple days later, the inflammation comes back. So my original step down date was, I think, the 15th, the day of my Humira. So after I took the Humira and stopped the Prednisone, I had another flare, so he put me back on the Humira. Back on the Prednisone and try to do another step down. Now, after that, for the second episode of the Prednisone, I stopped that second episode on August the 8th. By August the 11th, I had another flare up. I was starting to feel the same kind of tingling pain in that same area where they diagnosed me before. So, I had messaged my doctor because I didn't have any more Prednisone, and so I needed some more, or some antibiotics or something. So during that time, I had another flare up and got hospitalized again. So we're going to rewind just a little bit. I'll come back to me getting admitted to the hospital, which was last week as a matter of fact. And today, if you think, today is August the 23rd. So I was hospitalized like August the 14th. So we'll get back to that. But so during this time with the Humira situation has been very great. The Humira rep Sasha, she came out, she's a nurse. Humira, when you sign up for Humira, they have this little form you fill out, and they have a representative call you. They set you up with a nurse. The nurse comes out and gives you like a starter kit, video of what they sent me and things like that. So as I'm talking, you'll see clips or whatever inserted around these areas or covering the whole screen, just so you can get an idea what it looks like. So the Humira rep, she came and talked to me. She told me about the medicine, its side effects, how it works, how it doesn't work, when it expires, what to look for, how to give it to yourself, all that kind of things. She gave me a nice little kit. She gave me a practice pen and things like that. So they were really, really nice. So when they sent me out the Humira, they sent me a sharps container, because you can't throw away, medicine in a regular garbage can. So they do ship me the Humira out. I don't have to go to the pharmacy to get it. They ship it straight to my job. I got it shipped to my job because you have to sign for it. So I don't be at home during the day, so I didn't want that. You can't leave it outside. It comes in it has to stay cool, so you can't leave it outside. So it has to be somewhere where somebody can actually sign for it, put it in the refrigerator, or you can get it yourself. So I work at a pediatrician's office, so we have medicine and stuff all the time, so I didn't have a problem with it getting delivered to my job. So I get it delivered to my job, and I keep it in the refrigerator there, because I usually have to give it to myself on a Friday at 11 o'clock. So I usually at work on that day, so I just give it to myself at work during my lunch break or whatever. But back to that. So the Humira rep, she came out and talked to me, help everything else. So she came with me when I gave myself my first set of shots, which was on July the 15th. So the first time you take Humira, you have to take it in huge doses the first 2 times. So the first time I had to give myself 4 shots. So I had to give 2 shots in each leg. And when I say it burned, okay?
All right, so
I'm so nervous.
Well, it's all right.
I'm a big baby.
That's okay. You know what, I am too. So, I'll go ahead and give you one. So, not feeling bad today. No fevers, nothing like that.
Oh, no.
Okay, good deal. All right. You ready to go with number 1?
Okay. So, anywhere, or it has to be in the upper thigh area?
Just, if you put your hands like this, basically anywhere right there.
Okay.
So
like
you're
right in here.
So you're going to clean it. Just pinch up an area. Remember, when you go straight in, slow count to 10, and
So
then straight
pinch
out.
it like this and wipe it off here. Okay.
And then you let that dry while you're getting your pen out.
Okay. Now to remember what spot it was in.
So everything looks good in there, clear, no cloudiness.
No. I
Okay.
see some little liquid.
Okay, good deal.
Okay. So
All right,
take
just
it
pull
off.
them straight off. All right, got to get the top
Remember
one.
what spot it was in.
Of course, that's fine. And, all right,
I think it was right here. So you
just straight in, and then click. You're going to hear a loud click, but leave it in and count to 10. Okay.
Okay, 1, 2, go.
Oh, you did it.
Oh, wow!
Is it a burn?
Yes.
Okay.
It's not bad, but it burns.
Is it getting better? A little bit better? Okay.
Yeah.
Most of the time, my patients say usually about between counting to 6, about the time they hit 6, 7, 8.
I don't forget to count now. I don't know what number
You should
we're
be
on.
good by now.
Okay.
And then just straight out.
Make sure the little thing is there.
There we go. And that's okay. A little bit of liquid on your skin's all right. Sometimes you see that.
Okay.
You can just wipe it off with your alcohol.
Oh, they did send me a sharp container. I guess I should have gotten that. Alcohol on it. Barely worse. All right, no one down.
Well, what do you think? I mean, you
I think I
seem
can
to
do it. I think I can.
Okay.
It's fine.
good.
It's just a little burn.
Well, you having to get 4 in the first day definitely.
So do I have to do 2, 1, 1,
We
then
want to
here, and here?
rotate. You could do different areas on your leg if you wanted to, but I would say use if you're
Do
going to
a
do
different
all on
leg.
your legs, I'd do 2 on one side and 2 on the other.
Okay. Let's move to this side. We'll come back to the other side.
Okay. Get better. So he was like, I don't know if it's any different.
See, you don't pinch your leg when you're doing
just kind of pinch up the tissue like that. You're
Okay,
good.
and then you can let it go once you stick it, or you have to hold it while you
just
stick
hold it.
Okay.
You did it. Okay.
Oh, that one hurt.
4, 5, 6, 7, 8, 9, 10.
Oh, goodness. Now that one got a little bit coming out of it.
Grab the tissue. And sometimes you'll have a little bit, and sometimes, you may see, like with that other leg, no blood at all. Sometimes you'll see a little bit, but it's usually not. And then, like I said, holding it there for a second. Here, I'll put that over here for you. Hold it. Excited and proud of yourself to get it all done.
And give it myself.
Yes.
I wasn't as squeamish as I thought I would be.
You did great.
And then the second dose, so you take the shot every 2 weeks. So the 15th was the first set. Then the 29th, you have to take the other 2 shots. So you take 4 shots the first time, 2 shots the second time, and then after that, I take 1 shot every 2 weeks. So every 2 weeks, I take 1 shot now. So the July 29th, I took 2 shots that day. You can give it in your legs or you can give it in your stomach. So I gave it to myself in my legs the first time just to see how it would work. It still stinged or whatever. And then the second time I gave it in my stomach, I felt that in my stomach it was less painful and less bruising than it was in your leg. I did get a couple of little bruises and some little stings for a couple days later after that, but it wasn't so bad. I mean, it's only every 2 weeks. Alright, you guys, so you saw that was my second dose of Humira, and I gave it to my stomach this time instead of into my legs. It hurt about the same. It really don't even matter where you put it, so it just stings for like the first 5 to 6 seconds, and then after that it's okay. My left side, your right side did bleed just a teeny bit, and then the right side didn't bleed at all. So yeah, everything went good. So I am still stepping down on my prednisone, so by the time I do another update video after this, I should be off of it, hopefully, if everything goes as planned. And so yeah, that's how it went today. And then I gave my 3rd shot on August the 12th, and then my next shot is August the 26th. I'm recording this on August the 23rd, so I haven't given myself the 4th set of shots yet, which would be August the 26th. So yeah, so basically she didn't come out the second time. I didn't feel like I needed her to come out. She did call and check on me. I'm referring to the Humira rep. She did call and check on me and see how everything was going. Did she want me to come out for the second shot? I'm a big girl. I think I was okay. I told her if I had any side effects or anything was weird was going on, I would call her. So they're really good about that. They'll come out with you every times they need to come out with you to feel, until you feel comfortable giving the shots to yourself. I'm a big girl, so I didn't have a problem. But if you have anxiety about giving yourself a shot and you just don't know and you just worried, they don't have any problem coming out. She gave me her personal number. I just called her, left a message, tell her when my shot is, tell her I want her to come out or not come out. And whether you have her come out or not, they're gonna call you probably a couple days before you give your shot, or a couple days after. So she calls me a couple days before and she calls me a couple days after, and I just give her an update. She asks me how I'm feeling and things like that. The side effects, I haven't seen any side effects from the Humira as of yet. Now the prednisone has lots of side effects. It makes me super hungry. I'm not tired. I'm on 10. Well, I mean 10 is like I'm super jittery all the time because it is a steroid, and my legs swell. So those are the 3 major things that I noticed have side effects for me on the prednisone. The only side effects I really don't like is swelling of the leg, and the tingling of my legs really does get on my nerves. I have to elevate my legs at work because they swell, or at home at night, so it does cause a lot of swelling in my legs. So that's the only kind of side effects I don't like about the prednisone. So that's my experiences with the 2 drugs that I have been on recently. I did go to the doctor today because, like I told you guys last week, I was put in the hospital. So last week I was in the hospital for 2 days. So alright, you guys, so I'm in the emergency room because last night, August the 13th, I had a fever and stomach pain, and I've been having stomach pain since Thursday, since the 11th actually. And yeah, since the 11th, because today's Sunday. Wow, I missed the whole day. I slept all day yesterday, Saturday, because I felt bad. And yeah, I slept all day. So I woke up this morning still feeling bad with a fever. So I called my doctor because he told me to call anytime I had a fever of 100 or more, just to see what he wanted me to do. And I did take my 7th dose of Humira on Friday. And as you guys know, Humira brings down your immune system. So if I already felt kind of sick since Thursday, but I didn't have a fever or anything, so I still took my shot. He didn't think I should not take it, but I don't know, it may be because I took the Humira, if I had something started, that it was getting worse. But I'm in the emergency room now, and they're gonna do a CT scan because where my stomach stuff hurts is where my appendix is. So they want to make sure my appendix is not the issue, and I just think it's Crohn's, and they send me home and not check my appendix and then have appendicitis. So I don't think it's my appendix, but we shall see. I heard appendix pain is really, really bad and that I shouldn't be able to talk or do anything, but I don't know because I never had appendicitis before. So, yeah. So that's where I am today. Yep. So we shall see what's going on. I'll keep y'all updated. So the doctor came back. I have a Crohn's flare. Alright, people, I'm in my room for the night. I don't know how long they're gonna keep me. The doctor hasn't been in here yet. But they have an order on here that I can't have anything by mouth. I'm fucking starving. Haven't eaten since yesterday. So that's not good. It seems like my stomach pains are getting worse. They asked me that I want some pain meds, but earlier I told them no, but we might have to rethink that. Oh, somebody's coming. Okay. So, yeah. I don't know what to say. I'm in here. I'll be back later when they tell me something productive in my life. Alright, bye. Hey you guys, so I'm back. So the doctor came in, it's Monday the 15th. The doctor came in today and said they're thinking about surgery. So you go from letting me out on Tuesday to possible surgery. So I told them that I wanted them to talk to my regular gastro doctor first because he told me surgery would be the last resort. So I want to see what he say and go over all my options and all that kind of stuff because I don't want to have no unnecessary surgeries. So yeah, I'm gonna need them to go over everything we need to try because like I've only been diagnosed with Crohn for 6 weeks and y'all already talking about surgery, but my GI doctor told me they would try everything before we do surgery, and the only thing you tried is steroids and Humira, so I'm not really sure if I'm comfortable with that. So yeah, I'm gonna need them to get that together. So we shall see what they say. Well, at least I'm on a regular diet, so I'm waiting for my breakfast to get here. Yay! Pancakes, eggs, sausage, grits. I'm starving, and some apple juice. So yeah, and then I'll take a shower and look like a decent person, brush my teeth. But yeah, that's just an update for today, and I will let you guys know what they say about surgery and things. I mean, I can't be coming to the hospital every month, of course. So, you know, if he's like, you're going to come to the hospital every month because you're just going to flare up every month, then I understand. But if they haven't tried everything they can try, I don't understand why you want to resort to surgery. Doctors love to just be cutting up on people. Y'all ain't going to be cutting up on me. I'm going to need you to try everything before you talking about you going to cut pieces of me out. And I've never had surgery in the 36 years I've been alive. And I don't plan to just be doing no surgery willy-dilly, okay? So, yeah. I'm going to need them to get that together. But yeah, I'll keep y'all updated. Talk to y'all later. Bye. Alright guys, you back. I know I was supposed to get in the shower and everything. I feel just dirty and nasty. But anyway, she got my little glove on and she brought my little scrubs. I'm about to get in the shower, but I just want to give you guys a quick update. So last time I talked to you guys, I think they said they was going to have surgery. So the doctors, the surgeon and my doctor got together and they agreed that they don't think I need surgery right now. But they do see it coming up in the possible future, but they don't want to do it right now. I don't know why. Nobody explained it why, and I guess I need to find out the particulars why. So when I get out, I'm supposed to talk to my doctor, so we'll see. Yeah, so they said I should be getting out of tomorrow. They're gonna monitor me some more tonight and stuff like that. So yeah, I will talk to you guys later. Bye. Good morning, you guys. My mom brought my bonnet last night. My hair ain't too ratchet this morning. Anyway, before I order breakfast, I want to give y'all guys an update because I don't think I updated y'all since yesterday about the surgery. So I decided not to do the surgery right now. I am going to have surgery though. I just have to get off of steroids and get it stable. So I should be meeting with my gastro doctor, I guess sometime this week, next week, you know, to discuss getting off my steroid regimen right now and getting my pain level together when I'm off steroids, because it seems like when I get off steroids is the inflammation and everything comes back. So they have to figure out how to balance that out before I can have surgery, because I can't be on steroids and I can't be in a flare when I have surgery. So
they're trying to figure that out. So they are going to let me out today, so I will be going home today. And yes, I just want to thank everybody for coming to visit, everybody for texting, Snapchatting, commenting on my Instagram, to feel better and all the stuff when I put on there that I was in the hospital. If you were my subscriber, I put it on Snapchat, but I didn't put it on the Miss Doing Me Instagram. It's on my personal Instagram, but I'm not taking any new people on my personal Instagram, so I Snapchatted out for you guys to see, and then of course this video will be up whenever it be up. So yeah, that is the overall plan right now. Today I'm not having any pain, which is good. I'm about to order me some breakfast, and then hopefully I'll be out here by noon. And yeah, so videos this week might be up later this week. They might just be super late. Like I might do the 2 videos, but they'll be like super late, but they might be up still this week. Because like I said, one of them is pre-recorded, the other one isn't, so I would have to record it. And then I would still have to record because I don't have a video for next Tuesday, but I have a video for next Friday. So I just need to get it together, I guess. Yeah, so that's just a little update. So I'll see you guys later. Bye. All right, folks, since my auntie came and got me, hey girl, we finna put this girl up into her house. Cause she rolled out of there in her pajamas. The doctor said, put your clothes on. She said, I got my clothes on. If y'all love Ashley, you definitely love her mama. This is my auntie. So I'm on my way home. I gotta get my prescription. And then they let me out of the joint for now, but they told me I gotta come back and have surgery. So I'm not definitely gone yet, but halfway gone. Halfway gone, but not all the way gone. So I'm hoping to get home before them children and get another nap in before they come home harassing me. You know, Big Ham, I missed you, Mama. And she gonna be hugged up under me all night tonight. She's probably gonna want to sleep with me. She can't sleep with me. She's like a wild animal. I can't sleep with her. Oh, she be kicking it. Yes. Wow. Buck wild. Next time I see you, I'll give y'all updates about surgery or whatever. I go see my doctor in 1 week after my antibiotics. So I need to go home and do something with my head. Yeah. What I need to do. Because I ain't washed it this week. I ain't washed last week. The hair coordinator got jacked up hair too. Okay, I need to go do something to my hair. Y'all know I don't be going out like this. Alright, y'all. Several hours later from the last clip, but I am out of the hospital. I'm at home. I've had my nap before them children got home, and I'm just eating dinner. My son cooked me some chicken and some rice. Yummy, yummy, yummy. So I'm just about to clean up my room a little bit and get ready for work tomorrow. But that's what's going on with me. So I will see you guys later. Again, thank you guys for all the well wishes. Everybody who got hit me up on my Snapchat, on my Instagram. I really appreciate it. You guys are the best. And I will talk to you guys later. Bye.
So those are the clips from the hospital. So as you can see, there's a possibility that I will need to have surgery due to the restricture and the scar tissue that I have in my ileum, which is my specific Crohn's, is Crohn ileitis or Crohn's ileum, whatever you want to call it. But in that area, so every time I have inflammation in that specific area because of the scar tissue. So the Crohn's flare causes it to be inflamed, which causes the scar tissue to be restricted, which makes it stricter, and so I have a problem, and then I usually end up getting admitted. So I've been admitted twice within the last 2 months, which is a lot. So today I went to the doctor, and it was a follow-up for my appointment. Hey ladies, so it's Tuesday, August 23rd, and I am on my way to my follow-up appointment. As you saw in my last clip, I was in the hospital last weekend. I went in because I had a fever, and my doctor told me, you know, if you have a fever, because you're taking autoimmune suppressants, sometimes that fever can lead to an infection that your body can't fight off, so you have to, you know, call in and see what you're going to do. Unfortunately, it was on a Sunday, so I had to go to the ER because they wanted them to be able to run labs and do a CT scan if they needed to do so. So when they ran my, you know, labs and stuff, I didn't have a fever by the time I got, I don't know where the fever, I swear I had a fever, y'all, but when I got to the hospital, it said I didn't have a fever, but they did come up on the lab test that I had some kind of infection. They didn't know exactly what it was, maybe a start of a UTI or something like that. They're still not sure what kind of infection I actually had, but come to find out, I got admitted. So You know, you saw in the clip I got admitted and all that kind of stuff, and they're talking about surgery and things like that. So today I'm following up with my gastro doctor to see if they're going to do surgery or not. And if, because they say ultimately they are, but I guess what I'm going to see is how soon, how bad was it when I was in the hospital, how bad was my flare up, you know, things like that. And just to answer some questions about, you know, different techniques, if we can do anything different, do I necessarily have to have surgery, you know, right now at this moment, is it that critical, which I don't think it is, or they wouldn't have let me out of the hospital. But yeah, that's what I'm going to do today, and that's it. So we're going to do that, and I'll see you guys after my doctor's appointment. Alright, you guys, so I'm out of the doctor's office. Sorry, I took notes so I could get my life together. But anyway, so basically what the doctor said is we have two options. One, to get rid of it right now, or two, to wait till I'm 12 weeks using the Humira to see if the inflammation goes away. Right now, this week will be, what, the 6th week? Yeah. Or my 7th, 8th, I think the 6 weeks mark, 6, 7. It takes 8 to 12 weeks for the Humira to work. He said the reason why he knows the Humira working is because I'm having restrictions. So Humira kind of, he said, dries up the scar tissue and the inflammation, so it makes it super dry, I guess. I don't know what that means in, you know, doctor term. But anyway, it dries it up, so when it gets inflamed and stuff, it's just working. So he says it takes 8 to 12 weeks to see, you know, once it's dried all up, for the inflammation to completely go away and not come back, whether I have scar tissue or not. The reason why they're not worried about the scar tissue is because I'm not having an obstruction, which means that bowel is moving freely and I'm still having bowel movements, so it's not an issue with me having bowel movements per se. But when I get the inflammation and the restriction and then it hurts and I have to go to the hospital and get admitted, then that's when it becomes a problem. So basically he's saying that after I finish this round of prednisone, he's not putting me on any more prednisone. He says if it comes back, inflammation comes back, then they're just going to do surgery. They're not going to discuss it, anything. That's just, he feel like that's the best way for me, and it has less risk than keep on putting me on meds or add different meds to try to get it under control instead of being on 500 different meds. He's like, since it's such a small area and you know you don't want to have surgery, but he said for me he feels like surgery would be the best option. So if I have another flare up, another incident or anything like that after I finish this prednisone, then it's done deal, I'm having surgery. Then I have to have a skin cancer test, because you know, we on Humira, you know, it lowers your immune system. I gotta have a bone density, I have a skin cancer test, and then they have to check me for glaucoma and cataracts. So these are all the appointments I have coming up. So hopefully within 8 to 12 weeks we won't have an issue and the Humira works pretty well for me. But if not, then the next step is surgery. So yeah, that was my result for the day. I understand where he's coming from. It is what it is. I mean, I don't want to be in pain. I don't want to take a million meds 100 times. So, you know, I can't be on 500 meds. It costs a lot of money for meds. So if surgery will fix the issue, then I'm fine. Now, I did ask him if I have surgery, do I still have Crohn's? Because everybody had that question, and so did I. Like, if you cut that part out, there's Crohn disease infested. Do I still have Crohn's? He said yes. He said, but your Crohn's right now is evident only in that one spot. So if we take it out, you do have Crohn's, but you won't necessarily, he said, have to be on Humira, because that's the area that was infected, and since we took it out, there's no need for medicine. Unless, he said the only reason why he would keep me on Humira is if once they do a colonoscopy and that kind of stuff, they do a biopsy and they see that Crohn's is evident in other areas of my GI tract, but they're just not flared up per se, then he would keep me on the Humira. But he said he would take me off of the Humira if he goes to my GI tract, they get a biopsy and they don't see anything else anywhere else, then he would stop it until Crohn's presents itself again in a different area of my GI tract. He said if it never presents again, then you just won't be on any more medicine. It doesn't mean you don't have Crohn's. It doesn't mean it'll never come back. But you know, you at this point, you would be in full remission or cured until, you know, it decides to resurface again. So I did ask him that. So I'm kind of good with the diagnosis for today and our plan of action. And I like how he has a plan, because most doctors don't. And he was real sure, he knew how to answer my questions. So I feel very confident in his ability to treat me and my Crohn's. And if he says that I need to have surgery, then I do believe that I will need to have surgery, and I won't question it. So yeah, that was my visit, and I'll see you guys. Bye. I'll see you guys. Bye. I'll see you guys later. Bye. Okay, so you saw the clips after my appointment. So basically, I'm at a point where when will the surgery actually be? It's not, am I going to have surgery? Yes, I'm going to have surgery. So basically, he's saying if the Humira doesn't work in this 8 to 12 week time period, then I will have surgery. So my, let's see. So today is the 23rd. So then if they decide to have surgery, it will be, so this is my 7th week. The 8th of September will be my 9th week. 11th week will be September 22nd. And then October the 6th, somewhere around there will be my 12th week. So if I'm not no better by the 6th, or if I have a flare up or anything in between that time, he's just gonna say, forget it, we need to have surgery, let's just get it done. So that is where I am standing right now with my Crohn's disease. I'm pretty okay with this diagnosis as far as surgery, because the way he explained to me, it would be more beneficial to me to have surgery than to be on so many drugs. So I would rather have the surgery, have it taken out, and have a little bit of relief for a long period of time versus being on a bunch of medicines that may or may not work, and then I have more side effects and those kind of things. Because the more medicine you take, the more side effects you're going to have. So I just need to be okay and have a full life without having a whole bunch of medicine, trying to take medicine all day, having all these side effects and all this kind of stuff. So if surgery is going to prevent all that, I'm all for it. Of course, there's risk with every surgery, but I have confidence in the doctors that I see. So yeah. And then I do have to have iron infusions. He did send me a message after that clip. He sent me a message, or had the nurse call me telling me that I needed to have iron infusion. So I'm gonna have to get that scheduled, and that'll probably be my next update. So that's so far what's going on with me on my Crohn's. That's my update right about now. So I will keep you guys informed. If you have any questions, please leave them in the comments below. If you're another Crohn's person or IBD person, leave any suggestion that you may have down below. Anything that you tried. Did you have to have surgery? Did you have to have a colostomy bag? How do you feel about it? Just let me know, and I'll talk to you guys later. Bye.